Go ahead and call the meeting to order. Go ahead and do roll call. Board President Jared Cook is here. Vice President Cindy Lakadakis.
Here.
Secretary Marlene Cushing.
Here.
Member Heather Kahn.
Here.
New member Joni.
Here.
Board member Joe Stratman.
Here.
Member Jim Roberts.
Here. Here.
Did I miss anyone? Do I have a motion to approve the October 30, 2025 hospital board agenda?
I move to approve the October 30th hospital board agenda.
Second.
All in favor?
Aye.
Approval of September 25th, 2025 hospital board meeting minutes.
There ad for the capital? I didn't see that. Did you add the capital to the budget? I mean, to the agenda?
It's in the finance portion. It is in there.
Okay, it's in finance.
Okay.
Yep.
Move that we approve it, the meeting minutes or meeting schedule.
I will second.
All in favor?
Aye.
Aye.
Are there any visitor comments? Any board member comments?
Only a quick comment about being glad to see the Rasmussen Foundation come through and I think they spent a good amount of time with Kinderskog and asked a lot of questions, gave some helpful information, and we appreciated that they made their way to Petersburg to actually meet and greet and see what we're all about.
And I would just like to welcome our newest member, Joni. Thank you for being here.
Yeah, thank you. I'm happy to be here.
Any other board member comments? Committee reports, resource.
A quick rundown, expenses are running a bit higher than our budget due to costs related to providing for travelers and cost impacts of our cost report. We're waiting for the MRI to begin producing revenue. And Phil talked about that a little bit today on PMC Live. Our investments continue to do well, though some of that is an increase in market value. Our balance sheet is looking good, and it was noted that our switch to in-house billing is working well. At present, we have 100 days cash on hand. We discussed the changing environment for grants, legislation, and insurance providers. We've been working to get similar costs for a variety of medical plans and are also working with additional contracted payers. We also discussed allowing unknowns in our capital budget, especially as we work toward the new building project. We have reserved funds to address this, and we'll talk about the possible adjustments to the capital budget during this meeting. As Phil mentioned on PMC Live today, we're still working with the state on the certificate of need, and we will continue to pursue this.
Any questions for Cindy? LTC quality?
This is Marlene. I was unable to connect into that meeting.
Thank you. Reports, case management, swing bed management. Any questions regarding that report by Elizabeth Hart? Seeing none, thank you, Elizabeth, for that report. Chief of Staff. Any questions regarding Selena's report? Thank you, Selena, for that report. Clinic, any questions regarding Kelly's report? Kelly. Community wellness. Any comments or questions regarding Julie's report? No. Thank you, Julie. Youth programs. Katie. Any questions or comments regarding Katie's report? None. Thank you for that report, Katie. Dietary. Any comments on Jeanette's report?
This is Marlene. Just a big thank you to Jeanette for the fabulous job she's done since she got here.
Joe?
Yeah, I just, I wanted to congratulate you on the citation-free audit from the Food and Nutrition Services Department. During the day I work for the state, I'm familiar with DEC and some of the inspections they do on restaurants and things, and I've seen some of those reports, and it is very rare that they don't find something to talk about. So congratulations on that. That's great. That's great news.
The food program for the staff. It looks like it's doing very, very well.
Just that you've put us on a good path, but we're really going to miss you. You've done an excellent job. And we really appreciate it.
For that report, Jeanette. Home health, any comments on Ruby's report? Thank you for that report. Go ahead.
She said it'd be good to get the board to support her about the Cedar Social Club. I'm just wondering how we could do that. Important spreading the word. So I think.
Social club.
We can talk offline about that. It's good strategy. It's a good opportunity to get the word out to the community. Certainly something we want to see it grow. So absolutely, yeah. Thank you. Mike, we'll be reaching out to you at the next KFSK PMC Live and then some.
Okay. Thank you, Ruby, for that report. New facility. Any questions or comments on Justin's report?
I do have one comment, and I feel like I'm a broken record, but I kind of want to put it out there publicly that I really feel strongly there were cones up for a while, but there needs to be some demarcation or a barrier in the area of the parking lot where you can see the gravel and it looks like you can just drive across the gravel, but there is a big ditch there. And if somebody goes into it, they're going to do a serious nosedive. And even if we just put cones up or a fence, like the snow fence down here at the harbor where it can open and close, just to make sure that people are safe, I think that's really important.
Okay, when you're up in the upper parking lot and you look down, the concrete there just matches right with the concrete on the street, and you don't even see the hole.
Yeah, there was cones there, and then we're
They
gonna.
took them all away
Yeah.
though,
No, I know. We're gonna get something a little more
Yeah.
permanent
Yeah,
there. Yeah,
yeah.
yeah,
but there's enough traffic there that should be,
sure.
probably need to be pushed back. Put back there.
Any other comments regarding that report? Joe?
I guess, the report mentions some of the items that were discussed at PMC Live today, and I didn't catch all of that show this afternoon. But the switch from basically having a two-phase construction moving to three. I didn't catch all of today's show. Who was the person there with you, Phil, that was talking about the change? Was that a hospital employee or?
No, that was the architect, Bettysworth North. So, and again, these are preliminary design. So earlier this year in the summer, Roy, I believe is on, had, our architect from Bettisworth North, had been hearing, how are we going to get to the next couple of phases with the funding challenges, both at the state and federal level. And he had requested that potentially having our steering committee meet to discuss concepts. And so we had a meeting, with Jared and the steering committee, which is Steve and members of the hospital leadership, medical director and facilities, myself, nursing, and talked about potentially breaking up the design to what could potentially be the next logical step that's a lower cost and has a turnkey or something you can open at the end of it. And long-term care is the part that was brought up as a discussion. And we're in the very early phases of that as part of like, what does that look like from a design standpoint? What would that look like from a cost standpoint estimate? So it's pretty early in the process. And I feel like that we should probably have more information as we bring it to before we bring it to the board for that sort of stamp of approval to go to the next level, which would be like a work session with the borough, an open house with the community. So those kinds of things. So really looking at an innovative concept to bring something that potentially isn't such a high sticker price that it's unachievable. And at the end of that phase, we have something we can open like the work building.
Yeah, one follow-up, I guess. You mentioned the steering committee. When did that meeting occur?
We had that, Jared, when was that? In summer? It was in July or August, I think.
Yeah, somewhere back then. I can't remember exactly the
think it
exact
was-
time period, but
Yeah.
it's been a little while. It was more of a conceptual, what do you think of this idea thing? We haven't gone much further than that.
Yeah, there's two things that we need to do. One is the facility assessment on the existing facility. And so Bettisworth came down and looked at that. And then Justin reported out last time also on the concept design and moving that forward. So looking at what that would look like would be really what we're trying to do. So the facility assessment is where we are with our current facility. Last time that was done was in 2015 with JYL. And so Bettisworth came down and did a report on that. And we haven't finalized that report yet. We're still working through some of that. And then switching over to either sort of an innovation or a next phase concept on an LTC is still in the early stages.
Yeah, you mentioned getting more information and bringing that to the board before, more concrete plans are put forth. Would that information come from the architects or from other sources?
The process has always been the steering committee. And then, so since Jared sits on that, then maybe one of the things that we could do would be when we report out on like LTC committee and some of the finance committee, maybe one of the things we could do is put on there the steering committee from a board to report out on potentially. Maybe that might be a good idea. If the board
It would
concurs
probably be
with
the
that.
best way to get information from that committee out to the rest of the board.
Mhm. Yeah. And then we could also, the other thing we could do is form a work group. I know Jim has expressed interest in that process at the last board meeting as well with the design concept.
Thank you. I think having a report like you suggest, similar to all the other committee reports, kind of a heads up for the board, would be a good idea.
Any other questions regarding Justin's report? Thank you, Justin. Quality. Any questions regarding the quality report by Stephanie? Thank you, Stephanie, for that report. Infection prevention. Any comments regarding Rachel's report? That report, Rachel? Executive summary.
Right. Does anyone have any questions on my report? I'll cover a few things that are not in there and then also cover some highlights in the report as well. First thing is, just like Cindy had mentioned, want to thank Rasmussen for visiting Petersburg and visiting with us with the Kinderskog program. They were very interested in the program and looking at potential ways we could utilize some of their tiered funding to support the program. So I want to thank Katie and Julie and her team for that visit as well. So that was very positive. I mean, the big thing on the horizon that's going to impact healthcare relative to Alaska is the healthcare transformation bill. And so a lot of the work and the information and discovery that we're doing right now and in conversations at the state or the hospital association is around that. We don't have more answers than what we've already been reporting, but the state has to supply or submit their application to CMS, which is the federal government. Then Centers for Medicare and Medicaid has to approve that plan. And then potentially, depending on how it gets selected and allocated by January, they're going to be approving and the amount of funding that the state will have to spend will actually be quite a bit. So earlier this year, in August, the state had put a notice out there for an RFI, request for information on projects. And I had submitted our RFI, including the concepts and the designs for the phases for the new facility and capital. And I did include that in an earlier board packet, with the intent of also the programs of a lot of the things they're doing, everything from home-based health to telehealth programs, behavioral health programs that we're doing, a lot of the direct primary care concepts and, related to alternative payer models. Those are the things we've included in our RFI that we are already doing or have plans on doing within our facility. And we're hoping that then a lot of that work then got submitted to the state, and the state is working through all the RFIs from the various hospitals in the state. And my understanding is those did go forward in some elements to the application process. Now, the capital funding part is not, the CMS has put out that they're not funding capital, but I am hoping there's some creative way around that from an infrastructure standpoint. So we'll see. Again, I don't have any details on that. We'll just have to wait and see what gets approved at CMS and the state level, and it's something I'll be reporting out on at probably every board meeting since. And I know Jason is in tune with that as well. He has some access to other states related to what other states are doing as well. So it differs from each state. Related to patient volumes, when Jason puts his financials, he'll talk a little bit about patient volumes. They're generally stable, largely across the different departments. Primary care has been up quite a bit. One of the things I do want to mention is a focus on specialty care has been a priority within the organization in the last couple of years. And one area in particular with scopes and colonoscopies that's something that we have been working very hard and trying to get contracts for that. And we did receive a contract, and we do have those, and tentatively hoping for a January clinic to get those restarted. So that's a positive to get that prevention service in Petersburg again. So very exciting there. Certificate of need also is taking up a huge amount of time on that regulatory process at the state. The phased process is what makes this part of the regulatory process pretty challenging. It's not just about the MRI, it's the building itself and how the state views the certificate of need and getting that, getting all their questions answered to move that through to get to the next level has been pretty onerous. So we're still waiting for that. We had a meeting last week. We submitted another letter, or they submitted a letter back to us, and then we have a response back to them, and hopefully that'll be the last part of the process before it goes to an open hearing process, which is would be the next step. That's all I had from updates, unless there was any other questions.
Questions for Phil? Thank you, Phil. Financials, Jason.
Excellent. I assume you can all hear me? Can you hear me?
Yeah, we do.
Little light.
Okay. So a little, okay, I'll speak up a little bit. So just reviewing the statistics really quick. Primary care is up from the previous 2 months, 984 visits. And a big piece of that has to deal with the specialty clinic, 132 visits. Radiology is consistent, down just a little bit. You know, the summer months are our busy months, and as we get into September, we go through next spring, a little lighter in some areas, usually in ancillary services in emergency department, but maybe busier in inpatient and that. Lab tests consistent, 2,261. Rehab services are down due to the loss of a therapist who's separated from the organization. Home health visits down a little bit because of this, you know, we're off of the summer months. Emergency department, typically we see 100 visits in the summer months, dropping to a typical 65 through the winter. Inpatient days, a little bit of illness going around. We had an inpatient, a little more than one a day, and swing bed patients also a little bit more than one a day. So just kind of like what Phil said, kind of consistent with the time of the year. A little lighter in some areas from the summer months, but busier in other areas. Long-term care continues to be full at 420 resident days for the month. Okay, I don't know why this is here. Okay. Gross revenues, 2.7 million for the month, or yeah, correct, against a budget of 2.6. So gross revenues were a little higher. Contractual allowances just a little higher as well due to the higher revenues. Net patient revenues almost on par, just a little bit above the budget. So 2,154,000 versus 2,142,000, so 11,000 above budget. And then 340B was a little higher than normal due to some transactions that were identified that hadn't been caught in previous months. And Kinderskog, consistent with the summer months. Grant revenues. The in-kind PERSACs, I think, well, that one's up a little bit because we have the new work building. And so there's additional grant revenues for the data that is in that area. So total operating revenues, 2.5 against a budget of 2.3. Okay, sorry. Gross revenue, gross expenses, 2.4, they're up as well. A little busier, a little bit more contract labor, as Cindy Lakadakis has shared. The income for the month, 101,000 against a budget of 160. Investments, much stronger. There were a little bit rebound of the market due to some turbulence this summer with tariffs and things of that nature. And then still receiving some grants, things of that nature for the work being done in the work building. So overall, very, very strong, very good month. Year to date, looking good as well. There's just a couple of things that we're monitoring. So we don't have the revenue from the MRI because we don't have the certificate of need yet. So we have it in the budget, but it's not happening quite yet. And we have some added expense, which would normally increase our cost report, but we usually update that after we get, about December, January, about 6 months into the year, and we see what our volumes are and our changes in costs. And we brought the work building on, and so we have quite a bit of additional cost. So we think there will be a positive move in the cost report. As we shared, our cash position continues to improve. Total cash in just operating cash, 3.9 million. And then in investments and building fund, another 4.6. That gives us days cash on hand of about 100 days. We just want to be strong going into the changes that are coming ahead of us with the cuts in Medicare, Medicaid, and folks not being eligible for Medicaid benefits, exchange plans, things of that nature. A lot of disruption going on in healthcare, and particularly rural healthcare. So just trying to make sure that we position ourselves to the greatest strength in all of that. Just a couple of final comments to make. We are working through the audit. There is a new audit standard, GASB, Governmental Accounting Standards Board. That's what GASB stands for. Standard 101, it has to deal with compensated absences such as sick leave. So the standard was issued in 2023 and takes effect in 2025. So this past year that is currently under audit. And so it changes the way we have to record that liability. Now it's not for the current year. It's not for the year of 2025. It doesn't hit the bottom line for 2025. What it impacts is actually the net assets, if you will. In a for-profit environment, we'd call it retained earnings. We call it net assets in a governmental environment. So that will probably be reduced by about $700,000. There's a loophole. We could change a policy with regards to compensated absences, but I'm not sure we're going to go that direction. It requires us to provide unlimited sick leave. So not quite sure we're going to go that direction. Phil and I and others, Cindy will talk about that. So most likely we'll go with the option of just issuing corrected financial statements for 2023, and then that will impact 2024 and 2025, reducing net assets by about $700,000. So, okay. That's what I have with regards to the financial statements. I think the next item on the agenda is with regards to the budget, the capital budget in particular. We did not, usually in any given year, we have about 100,000 that we put in there to deal with just miscellaneous things that we don't anticipate breaking, but every year there's something that breaks. And that wasn't put in this last year's capital budget. And we're starting to have a few things break. And so we feel it would be good to ask the board to put that standard cushion in there. And so we're requesting to increase the capital budget by $100,000. Any questions on the financial statements or on our request to modify the budget, amend the budget?
And I believe in the past, we had the $100,000 in our budgets normally, and for whatever reason, we failed to put it in this time. So it would not be abnormal for us to have that in there. Are there any questions for him before we go make a motion on it? Regarding that?
This is Marlene. Are something like the new CAT scanner, is that going to be leased or is that going to be purchased outright?
I would say most likely we would try to either lease or finance it in some way. It's best with large pieces of capital equipment to finance them over the useful life and preserve our cash. For any kind of borrowing we may need to do or desire to do with a larger capital project, what will help us get the lowest interest rates and best terms is to make sure that we have days cash on hand, upwards of 120, 150 days. We're currently sitting at 100, and so it's best to preserve that cash and be able to borrow at lower interest rates. The other thing that's beneficial about some of our leasing, capital leasing and operating leases is we're a not-for-profit organization. And so when we lease through a company, they retain title to it and they were able to depreciate that product. We depreciate it too on our cost report, but not on our taxes. They're able to depreciate it on their taxes. And so that gives us a lower interest rate as well because it saves them money.
Joe?
So I see in the capital budget, there is, some of the departments are kind of laid out there, but the dietary isn't. So, the dietary report mentioned, a refrigerator and an oven that needed to be replaced. So could this, this 100,000, if it were added to the capital budget, potentially be used for those items in addition to other things?
Yes.
Yes, okay. Thank you.
Any other questions before we? So I would be looking for, entertain a motion to add $100,000 to the capital budget to replace equipment that fails unexpectedly, and that needs to be replaced in the current year, if someone wants to make that motion.
So move.
One second.
Any discussion? Can that be just an aye vote, or does it have to be roll call?
Roll call is probably fine.
Probably be a roll call vote.
Roll call for the vote, Board President Cook,
Yes.
Board Vice President Lagadakis,
Yes.
Board Secretary Cushing,
Yes.
Board Member Khan,
Yes.
Board Member Johnson, Board Member Stratman,
Yes.
Board Member Roberts.
Thank you, Jason, for your report.
You're welcome.
Let's see, no old business, new business, review of current board committee appointments. I'll read these off. Right now, under quality and improvement committees and long-term care, we have Marlene Cushing. Infection control is Joe Stratman. Critical access hospital, Joe Stratman. Resource committee, Jared Cook, Cindy Lakadakis, James Roberts. Joint conference committee, board president, Jared Cook. Foundation Committee, Marlene Cushing. Community Engagement, Marlene Cushing and Cindy Lakadakis. Evaluation Committee, Jared Cook, Heather Kahn, and Kim, past board member, was on that. Bylaws Committee, Jared Cook, Joe Stratman, James Roberts. Kinderskog Advisory Committee, Cindy Lakadakis. And those are the present committees and stuff, and we would be looking to shuffle those around if need be at the next meeting. Is that correct? Okay. So everyone has a chance to think about those, decide if they want to be on something different, or talk to other board members about what they would like to move around, and gives you a chance, Joni, to see if there's some that you'd be interested in. Election of officers will be at the next hospital board meeting. And that meeting will be scheduled for December 4th, 2025 at 5:30 PM due to Thursday falling on Thanksgiving. Are there any questions regarding that date? I think we talked about it the last meeting, so. If not, do I have a motion to go into executive session to discuss medical staff appointments, reappointments, and any legal concerns?
Go ahead, Jim.
Is there a second? All in favor? Aye.
Aye.
Okay.
So glad I had a conference room.